Colorado's Amendment 69 has a new backer in the form of Bernie Sanders. Now, those of you who are unfamiliar, Amendment 69 is a ballot measure in Colorado that would essentially create a state version of a single-payer healthcare system. Kind of like a Medicare for all, but only in Colorado. Now, this is, as I said, this is just like the national single-payer plan that Bernie Sanders proposed during the primary. Now, like it, the single-payer system would be funded by payroll taxes. Now, immediately, right, everybody was like, oh my God, I don't want to pay taxes. That's a tax increase? Yeah, but don't worry, right? Yes, it's a tax increase, but it also eliminates all funding, or not all funding, sorry, all the payments that would end up going to the insurance company. Things like executive bonuses. I mean, this is what you pay for, right? You pay for people to sit in a room and deny people claims. That's what some of the money that premium goes for. Yes, I know the Affordable Care Act did mandate that a certain amount of your money be used for you. I know, right? They actually had to legislate that in because if they could, they wouldn't use any of your money on you. It would be on to get the CEO another yacht or whatever, or advertising, marketing, etc. So that money, most of that money doesn't get spent on you. But regardless of that, right? A lot of your money in those premiums goes to things that it shouldn't. That's why a single-payer system is actually much more efficient. That's why in the long run, when you're talking about taxes and you talk about a tax increase, well, opponents of single-payer seem to forget that you would save so much more money by eliminating payments to health insurance companies and just doing it through taxes. It's more efficient. Anyway, now, when it comes to this, in Colorado, people could still choose to pay private insurance companies, but they would still be required to pay the tax. So really, it wouldn't make sense to do private insurance. Now, Bernie Sanders last week endorsed this plan during an event in Vermont. Now, he said, quote, it is absurd, it is beyond belief that here in America we remain the only major country on earth not to guarantee health care to all people. And he said of Amendment 69, if that proposal could win in Colorado, I believe the idea of health care will spread around the country. Now, Owen Perkins, a spokesperson for the Colorado Care Yes campaign, which is, by the way, what this program would be called, Colorado Care. He said in a statement, that it's hard to imagine a figure whose support of Colorado Care is more meaningful than Senator Sanders. Well, considering he ran for president on the platform of let's expand Medicare for all, that makes sense. In fact, he says, no one here has done more to elevate the idea of Medicare for all in the United States in recent years. And by bringing the notion of universal health care into stadiums, auditoriums, town halls, and living rooms throughout the country, Senator Sanders has helped create the ideal environment for passing Colorado Care. Now, if Colorado approves the amendment, it would be the first in the nation to implement single-payer health care. Now, Vermont had tried, and Vermont voters unfortunately rejected that plan. Shame on you, Vermont, right? And as Healthcare for All Colorado Executive Director Donna Smith told Common Dreams back in November, that could have national implications because, quote, we are not relying on the elected officials to advance universal health care. It is a ballot initiative. Much like legalizing marijuana was also a ballot initiative. Now, here's the thing, right? I like how this takes away from the elected officials. Because elected officials, she's right, they won't do it on their own. They won't advance universal health care. Why? Well, look, most of our politicians, including Democrats, take a lot of money from the health insurance company, the health insurance industry. I mean, look at Howard Dean. Look at how much that money corrupts, right? You had Howard Dean, who ran as a progressive and supported a single-payer system, who is now against it and now works as a lobbyist for health insurance companies. That's how much that money corrupts. And look, Hillary Clinton once also favored at least universal health care, right? Now she has refused to support a single payer system. Basically, she thinks, well, Obamacare's enough. We got 90% insured. Great. However, it's not. Yes, it has helped a lot of people. Sure. But see, 90%, that doesn't mean that 90% of people can go in and get health care today. Oh, a lot of them have plans with very high deductibles and high co-payments. So they can't actually just go in and see a doctor. They've got to often save up a lot of money. And in an emergency, that's incredibly difficult to do, right? That's why Obamacare is flawed as a premise. The whole premise of handing over healthcare to insurance companies to force private citizens to buy into it is a flawed proposition. It's also a right-wing plan. It's heritage care. Now, in exchange for this whole thing, the insurance companies, look, they've got a near guaranteed user base, right? Everybody's forced to buy insurance. Well, that's profit. Now, in order to make the deal with the health insurance companies and get this passed, the government did have to do that. They had to promise, hey, you're going to get people. You're going to get young, healthy people that are forced into the exchange. But in return, you have to cover sick people, right? So the government got some concessions out of this. But overall, the whole plan hinges on the goodwill of the insurance companies to play ball. And as we've seen from Aetna and some of the other large insurance companies, that goodwill seems to be at an end. They're pulling out. It's not because they're not making profits. Sure, their profits aren't as large as they used to be. Aetna themselves says, we lost $200 million in this last quarter, but you still have a profit of $700 million. I think you're going to be okay. No, the whole reason that Aetna basically said we're leaving the exchange is because the Obama administration decided to block one of their mergers that would have been worth billions of dollars. And once again, the corporate politics of this whole thing is why we shouldn't leave this whole thing up to the insurance companies. Why they shouldn't have created, why this whole thing of for-profit health insurance is a flawed proposition. I don't want my health care to be at the mercy of a for-profit insurance company that only cares about their bottom line. I think that's a terrible thing. And if I were in Colorado, I would gladly pay a higher tax of my income to guarantee health care for me and my family. It leads to better outcomes. And look, as other countries have shown us, it's not like nobody's ever done this. We see this everywhere. This whole thing. Single-payer healthcare is more cost-effective, more efficient, and it's also the right thing to do. Politically, this is smart. Morally, it's right. Politics and morality on the same side. That doesn't happen every day. Come on, Colorado. Do the right thing and pass Amendment 69 and make healthcare a human right. Hey everybody, if you liked this video, then please like this video and share. And if you want to see more like this, then please hit that subscribe button below.